So, in today's class, we will be discussing about epidemiology of infectious diseases. So, you had your PSM classes. Do you have any idea about what epidemiology is? Now, first of all, just look at this picture. What do you see? Till now, whatever we had discussed in case of infectious diseases, we had discussed only about the human genome, that is the constituent of the human body, and how the various microorganism affects and thus leads to causation and effects of what we call as infectious disease, right? That is the human and the interaction between human and microbes. Now, please keep in mind, this is not an individual matter. When one person gets infected, that person is not an isolated person. We as human beings are not isolated, we live in social circles, families, friends, groups, society, the community, the population, country, and the whole world as a whole. So, whenever we are talking about any diseases which affect human beings, we have to take everything in context, including the environment that we live in. So, when we are discussing about epidemiology of infectious diseases, it encompasses everything from the individual to the organisms which causes the disease to the society in which we live in, including the environment, the world environment as a whole. Okay. Now, let us delve into deep further. In today's class, we will discuss about these things. First, we will go through some of the basics, that is the basics of epidemiology. What are the different parameters that you should understand? Then, we will discuss about how the disease causes, the different variations, the temporal variations, geographical variations. Next very important thing would be what we call as an outbreak investigation. That means in the society, in the population, whenever a disease occurs, this must be investigated. Why the disease is occurring, how is it spreading, and what can we do to stop the spread of the disease. For outbreak investigation, maybe a one-time investigation that is done for specific disease, but for all other diseases that we do know, the diseases about which we know almost everything, and some of the diseases which even we have controlled, those should be surveyed. Why surveillance is necessary? To keep a monitoring whether the disease is actually spreading or not. We will also look into the surveillance, the programs, everything is targeted about prevention. Whatever we do, our chief target would be how to prevent the disease. Okay. And finally, we will just also touch a little bit about the various mathematical models that are used for prediction of how an epidemic or an outbreak may progress and proceed. So, let us start. First is, what do you mean by epidemiology? If you look at this word, there is a word that is called as demi. What does demi means? Demi mane ki? Demography means? Demography means? What is democracy? Huh? Exactly. So, demography means the calculation of the population, and epidemiology is study among the population. So, when we are talking about epidemiology, we are not talking about a person, single individual. We are talking about groups of people. That is what is meant by epidemiology. Understood? Okay. Now, epidemiological studies are done in case of all types of diseases, including communicable disease, non-communicable disease. But when we look at infectious diseases, the epidemiology is slightly different from the non-communicable disease. Why does that matters? For example, you as an individual, I think you have heard about metabolic syndrome, obesity which leads to hypertension, diabetes and other many factors. Suppose a single person individual starts eating, has a sedentary life, starts eating more than he or she should, what will happen? That person will become obese and then ultimately develop hypertension, diabetes and etc. All these factors will affect that person as an individual only. It will not affect his or her friend, right? But in case of infectious disease, what we do know is they are communicable. That means the disease can spread from one person to the other. So over here, all the factors which affects a single individual will also affect the population as a whole. So these are some subtle differences between epidemiological studies of communicable and non-communicable diseases. Next, if we look in, when we are doing the studies for epidemiology, what should be done is called as shoe leather approach. Shoe leather approach means we as investigators has to go out and reach to the population. That is, manual evaluation should be done. Otherwise, many small factors might be missed, which will ultimately have a disastrous outcome. So this approach should be followed in case of studies, epidemiological studies in case of infectious. Why this is important? If we look at the global burden of infectious diseases, historically speaking, there have been many epidemics and pandemics which were initially called as plagues, various diseases. That could include the plague itself or the Black Death or syphilis. All these diseases have created an havoc on the human populations since historical times. Over the last 100 years, what was previously thought that infectious diseases could be controlled, this logic was then repulsed, as today we can see many more pandemics. Those are called as the silent pandemics. Most notably, the HIV/AIDS pandemic that is still going on. Over and added, we have seen the SARS virus, the coronavirus pandemics, all these pandemics are occurring. Hence, what we can conclude, even with many antimicrobial agents, any modalities of treatment, many immunization programs and availability of the vaccines, in spite of all those things, infectious disease still is a big global burden. And especially in resource limited countries like Africa, including India, where resources are very much limited. The WHO has given out some of the diseases which are still very much prevalent and are of very important significance. Most notably, the lower respiratory tract infections, especially in infants, elderly, and immune compromised patients, followed by diarrheal diseases, especially in underdeveloped and developing countries, in children, HIV, tuberculosis, especially in India, and other diseases like malaria in African countries and Indian countries. Now, having said that, what is the purpose of the studying epidemiology? If you look at this picture, what is this picture? This is we call it as the chain of transmission, which includes the agent, the reservoir, the portal of exit, the mode of transmission, portal of entry, and the susceptible host. So, at any point of time, if we are able to break this chain of transmission, we can limit the spread of the disease. So, that is the overall purpose. Okay. How does this works? Historically, let me tell the story about this person, Walter Reed. During the 1900, the US government was building what today we know as the Panama Canal. In that tropical region, an unknown fever were killing. আস্তে ক্লাস হচ্ছে এত কথা কি আছে? So during that time, during the construction of the Panama Canal, many people were succumbing to an unknown fever. So what this person did, he did his own study and he deciphered that somehow this mysterious disease was linked with mosquitoes. And what he did was advised use of mosquito nets for all people. And suddenly the spread was disease of this disease was stopped. So he did not know the causative agent, he did not know what was the disease, but he was able to prevent. Another very notable story that I think you have heard about this person called as John Snow. So in 1854, London had an outbreak of cholera. At that point of time, the drainage system in the city of London was not well developed. So people were extremely puzzled that how this disease is occurring. It was only after John Snow, what he did was he mapped out all the cases of cholera on the map of the London, and he thought, based on his study, that it is somehow related to drinking water supply, where sewage and drinking water were getting mixed. And what he advised was separation of drinking water pipelines and sewage pipelines. That single intervention resulted in stoppage of the cholera outbreak in London. He was not a doctor, he was not even concerned with the disease itself. So there lies the importance of epidemiological studies. What is, even without full knowledge of the causative agent, prevention can be achieved. Okay. In today's world, the picture has changed drastically. First of all, we do have various new modalities of laboratory diagnosis and treatment. However, as the time passes on, more and more number of pathogens which were previously unknown are now being identified. All are potential agents for outbreaks. Furthermore, the population that we deal with has also changed significantly over the last 100 years. Now, as if you do look around, you can see many elderly people, more than 70, more than 80, some even octogenarians are still surviving. So, we have a larger pool of susceptible hosts, including people who have been treated for malignancies or immune compromise otherwise. Next is globalization. In today's world, not a single country is isolated from the other countries. If we look at how the SARS or the corona pandemic outbreak actually occurred, it initially started in China, and over 1 month period, it spread out throughout the world because of the globalization issues. People are moving around. Goods and cargoes are moving around the world at a very rapid pace. And last but not the least, in 2001, when the World Trade Center was destroyed, after that, there was an attack of anthrax that was done with the use of the US Postal Services. This was termed as bioterrorism. So, these infectious agents can also be used as a potential terrorist activities. Nevertheless, today, with advancement of the molecular techniques, we can identify the causative agent and can diagnose the case much more rapidly with these advanced cases. Furthermore, today's internet, computers have led to more rapid investigation and dissemination of reports. Now, let us look back at the basic concept first. So, infectious disease epidemiology sits at the intersection of biology, microbiology, climatology, ecology, and epidemiology. It encompasses everything. Furthermore, we have to look at the natural history of the disease. What is the natural history of disease? This is the natural history of the disease. So, if there is a susceptible host and that host gets exposure, that host will develop in the initial part what we call as a subclinical disease. That means the infection has occurred, however, the patient is not showing any signs and symptoms. Thereafter, we call it as the stage of the clinical disease. That means now the patient is showing some signs or symptoms related to the disease. The outcome could be either recovery or recovery with some or many disability. And the last one is the patient might succumb. So, let us look at some of the definitions. First is infectious disease. What are infectious diseases? Infectious diseases are the diseases caused by organisms. We generally call them microorganisms, but some of the parasites like helminths, they are not microorganisms, so we can call it as organisms. Next is communicable disease. What is a communicable disease? A disease which can spread from one person to the another. So, all infectious diseases are communicable diseases? No. All communicable diseases are infectious diseases? Yes. Okay. What is contagious disease? Contagious means when a person comes in contact with a diseased person, the person might get the disease. So, it can happen directly or indirectly. How directly? By skin to skin contact, by touching, or through airborne or droplet infection. Okay. HIV is a contagious disease. Is it a communicable disease? Is it a communicable disease? Or is it a contagious disease? HIV is a contagious disease. So, if you go and shake a hand of a person infected with HIV, you will get the disease. But it's a communicable disease. There are routes of communicability. A syringe, infected syringe can lead to the disease. So, these are very subtle differences that you must understand while. And now, transmissible disease. What is a transmissible disease? It's a broader term in which all kinds of transmission can be encompassed. For example, there is an infection called toxoplasma infection. If it does happens in males, most of the time it will be asymptomatic. But in case of females, the mother may transmit the infection to the child. That is transplacental transmission. So, it is also transmissible disease. So, always be careful while using these terminologies. Malaria is a transmissible disease. Is it a communicable disease? Yes, it is a communicable disease. Is malaria contagious? No. You can't get malaria just by touching or coming in contact with the patient. Okay. Now, please remember, exposure to the microorganism does not always lead to disease. The first step is, after exposure, the microorganism must reproduce and propagate on the host. If it is able to reside on the epithelial or the side portal of entry, then only it can cause disease. Otherwise, the organism may just live on the surface. That what we call as colonization. Colonization does not mean infection. So, after exposure, infection can occur only if the dose of pathogen is sufficient, what we call as infectious dose. If the number of the pathogen is lower than the infectious dose, the infection will not occur. Next, it will also depend on the host immunity. An organism which may be a colonizing organism may not cause an infection in a normal or immune host. But in case of immune compromised host, it can cause the infection. Next, environmental conditions. Environment means not only the host but also the environment itself. If the environment is not conducive, the infections will not occur. A very good example would be the spread of influenza virus. The influenza viral infection is more commonly seen in the winters. It is not commonly seen in the summers. Why? Because the colder environment allows the virus to survive in the nasal epithelial cells. Okay. Next, what is the case? Case is a person who has a disease. That is what we call as a case. Then what is an index case? What do you mean by index? Index মানে কি? Index means the starting point. So, whenever we try to investigate about a disease, the causation, epidemiology, everything, we must start from a case. That case is called as index case. Okay. Is it always the first case? It may or may not be. Maybe the first case that was reported, the person has already died or person has already recovered. You cannot start the investigation from that person. That will be the primary case. It may or may not be the index case. Have you understood the difference? বোঝা গেছে? Secondary cases are the cases which occur when these susceptible hosts come in contact with the primary host, primary case. Those are called as the secondary cases. Next, what is a reservoir? Source. Source is the place or person from which the microorganism is acquired. That is the source. And what is the reservoir? Reservoir is the habitat of the normal pathogen. It could be an environmental reservoir, it could be an animal reservoir, it could be human reservoir. What is a vehicle? A vehicle is an inanimate material. Inanimate means a non-living material which can transmit the disease. It could be food, water, direct contact, that is fomites. If that is a living being, we call it as a vector, like mosquito, flies, etc. Again, the chain of transmission and the mode of transmission. What are the modes of transmission? Transmission can occur directly or indirectly, or through vector borne or airborne. Other modalities of transmission would be congenital, that is transplacental, perinatal transmission, that is during birth, or even through animal bites, like in case of rabies. Now, these three definitions that you must understand. You have already understood who is a susceptible host. Host means the organism in which the disease is occurring. We call it as the susceptible host. In cases of many of the diseases, there are many hosts. One is called as the definitive host and one is called as the intermediate host. Other than that, the other host that can be an indicator host, a maintenance host, or an amplifier host. I'll give you an example. There is a kind of a zoonotic disease called as hand, foot, mouth disease. Human beings generally do not get the infection, but people who come in contact with cattle get the infected. The infection occurs from cattle, that is cows, buffaloes, etc. But the disease is caused by the virus. That virus is generally maintained in pigs. The viral infection generally occurs in the pigs, and these pigs also acts as an amplifier host. So when the cattle comes in contact with pigs, these cattle gets infected, and we can see the disease manifestations of hand, foot, mouth disease in cattle. So over here, the indicator host is the cattle, who actually suffers from the disease. However, the pigs, they do not get the disease, they only become amplifier or maintenance host. Okay. Now let us talk about the human beings. When human beings get infected, the disease occurs in this scenario. The first is we call as incubation period. What is the incubation period? It is the time period from the exposure to the first manifestations of the disease. It could be a sign, it could be a symptom. So the time period between exposure to the first signs or symptom is called as incubation period. Now what is the latent period? Latent period is the time period from exposure to the first instant when the patient becomes infectious. It may coincide with the incubation period or it may not coincide with the incubation period. For example, in case of a viral respiratory infection, the latent period and the incubation period is almost similar. When the person starts to cough or sneeze, that person becomes infectious. So that would be the latent period. What is serial interval? After the patient becomes infectious, say the person starts sneezing. So by the droplet infection, he or she will give, another person will acquire the infection from the previous person. So the time difference is called as the serial interval. That means from first case to the second case, the time interval is called as the serial interval. Understood? So what is an incubation period? It is the time gap between exposure and first sign or symptom. What is the latent period? From exposure to infectivity. And what is the serial interval? Time requirement for getting exposure from the first case and the second case shows signs and symptoms of the disease. Why these are important? Because this will help us plot what we call as an epidemic curve. I'll come to that later. Now when the disease spreads, it can spread in these four fashions. The first is called as endemic. Endemic means the disease is always present in the population. Then we call it as endemic. That means, let us take an example like malaria. we can find malaria cases at any point of time, any time of the year, be it summer, winter, rainy season, doesn't matter. And these cases are always present in the population. So, we can say Indian population is endemic for malaria. But what is an what is an epidemic? Suppose there is a sudden rise of cases of malaria, then we will call it an epidemic. So, what is this sudden? There must be a definitive mathematical number. That mathematical number is given by the standard deviation. I think you will learn later on. So, if you plot any graph, that is something called as standard deviation. If the number of cases are more than 2 standard deviations, we call it as an epidemic. However, for some diseases, the number of cases should be 0. For example, cholera. There should be no cases of cholera. Even if there is one single case of cholera, we have to declare it as the epidemic. Understood? Next, pandemic. I think this you are always aware. Pandemic means when the disease has spread out to a very large population, generally speaking, more than many countries are affected. Then we call it as a pandemic. Another manifestation that we can see is called as sporadic. Sporadic means it happens once in a while. We can say that many viral etiologies, they comes once in a while, every 3 to 4 years. Then we call it as sporadic. I have already told you about infectious disease, those environmental factors. For example, malaria will spread when the number of mosquito will increase. The number of the mosquito generally increases, especially in the rainy season. So, it is expected that number of malaria cases will increase in the after the rainy season. Or in case of flooding, the gastrointestinal infections will be much more. Host factors, obviously, children and elderly are more easily affected. Now, there can be also temporal patterns. Temporal means with time. It could be a seasonal variation, influenza, based on the seasons, like the winter season, or it could be a cyclical periods. For example, measles. Every 3 to 4 years, we will get cases of measles infection in children, or it could be secular trends. Generally, smallpox after vaccination has not been seen, but we can see many other pox infections also. These are called as the secular trends. Now, how do we decipher all these things? Based on the geographical distribution, where these cases are seen and mapping is done. Now, let us come to the epidemic curve. What is this curve? Suppose there is an increasing number of cases. It could be a endemic disease, it could be epidemic, it could be pandemic, or it can be an outbreak. So, what we need to do? We need to plot a graph where the y-axis will show the number of cases and the x-axis will show the time. Now, the epidemic curves can be either point source, continuous, common source, continuous, intermittent common source, or it could be propagated. Let me explain to you. Suppose in this room there are 100 people sitting. One person is infected with, say, chickenpox, and that person starts coughing and sneezing inside this closed room. So, what will happen? Among the 100 other people who are exposed, let us say 50 of them will get infected, and slowly we can see, if we plot the graph of this whole area, we can find there is a sudden surge of number of cases. That means at one point of time, a large number of people were exposed to a particular pathogen. Then we call it as point source epidemic. Understood? Now, let us take another example. There is a village in which there is a particular well which is used for as a source of drinking water. Now, if that well is contaminated with a pathogen, what will happen? We will find continuous rise in number of cases in that particular area. And if we plot the graph, we can see, unlike the point source epidemic, which where there is a sudden surge of cases, over here we can find continuous increase of cases and then a delayed slope. This is called as a common source epidemic with continuous pattern. And if that infection is intermittent, that means it is not occurring regularly, what will happen? Especially seen with vector-borne diseases like dengue and malaria. Then we can find that in that particular area there is a sudden surge of cases, the cases dips and then again the cases rise. That is called as, that means there is a common source where the mosquitoes are there and people are getting exposed, but the infections occurs intermittently. Then we call it as a common source and intermittent. And finally is called, we can see the propagated. Propagated means, for example, the recently the coronavirus pandemic, what happened over there? A few people got infected, they had full access to everybody else, more people got infected, those who had access to other people, they got infected, and it goes on. This is called as a propagated epidemic. That means the number of cases starts to rise very slowly and it keeps on rising. That means more and more number of people are affected. Okay. You have understood the epidemic curve? Now, what is the importance of the epidemic curve? Suppose there is an outbreak of a disease about which we have very little knowledge. If we only study the number of cases with time, we can plot this kind of graph. And this graph will tell us whether it's a point source epidemic, whether it's a continuous source epidemic, or it's a propagated epidemic. So even if we don't know the causative agent, even if we don't know how the disease is spreading, just by studying the number of cases with time period, we can anticipate the kind of epidemic that we are dealing with. Understood? Okay. Now, another very important part would be the contact tracing. That is, suppose there is a person who is infected with the disease and we don't know what is the mode of transmission. The first thing we need to ascertain, how many people have come in contact with this person. Okay. And that will depend, obviously it will depend on the mode of transmission. For example, if it is a respiratory disease, so what are we looking at? We are looking at people coming in contact, that is either airborne or droplet infection. And if the disease is a sexual disease, so will we be concerned about anybody coming in contact for airborne or droplet? Obviously no. So we need to trace out all the people who have come with sexual contact with this person, and we have to investigate all those people. Now, another important aspect in case of epidemiological studies would include these rates. The first rate is called as incidence. What is incidence rate? It is the number of new cases in a population. Suppose there are 150 students over here and 10 students get infected by influenza. So, what would be the incidence? It would be 10 by 150. That is the incidence rate. What is prevalence? Prevalence is the total number of cases at any given point of time. Good. So, in incidence rate, we are looking only at new cases, but in prevalence, we are looking at all cases. Now, I will give you two examples. The first is influenza, and second is tuberculosis. Now, tuberculosis is a chronic disease. If a person gets infected, he will suffer from the disease for a prolonged period of time. Now, suppose there are 100 people, 10 of them get infected with influenza. The incidence rate will be 10 by 100. Now, similarly, if 10 people are get infected with tuberculosis, the incidence rate will be again 10 by 100. But if we do the study again, say after 1 month, what will happen? All those 10 people who were infected with influenza, they have recovered. Now, if we study, we can find the incidence rate is 0. But all the people who have already been infected with tuberculosis, they are still disease state. So, our number will be 10, and suppose 2 people get infected further. now our prevalence will be 10 plus 2, that is 12. Understood? So, generally speaking, diseases which has a very short period of disease period, they have a very low prevalence. It could be a disease from which people get recovered like influenza, or it could be a disease which is extremely fatal like rabies. Whoever gets infected will die. So, what would be the prevalence of rabies? 0. But still we see cases of rabies. That means incidence is there, but prevalence is not there. So, prevalence is more important, especially in case of chronic disease. The next rate what you must understand is called as attack rate. What is attack rate? Again, let us take an example. If there are 100 people, they are exposed and say 10 get infected, the attack rate would be 10 out of 100. In case of another disease, if 50 people get infected out of 100, the attack rate would be 50 by 100. So, what does it denotes? এটা কি denote করে? It denotes the potentiality how the infection can spread, how virulent it is. If the attack rate is high, number of cases would be very high. Another is secondary attack rate. Secondary attack rate means suppose there is an exposure, 10 people got infected, and from that 10 people, say 20 more people got infected. So, that would be the secondary attack rate. That is, in what intensity secondary people will get infected from the primary case. That is called as secondary attack rate. During our study, we need to do studies. There are various types of studies. I am not going into the details of the studies, but what you need to know is these are the 4 types of studies that can be done. The first is called as a cross-sectional studies. What is a cross-sectional studies? Suppose there is a population of 100 people and I look for a disease in that 100 people at one point of time, that is called as cross-sectional studies. As if we are cutting a cross-section, like cutting a cross-section of a tree to look what is inside. That is called as a cross-sectional study. It is very easy to do and it takes a snapshot at a period of time. The next kind of study we can do is called as case control studies. We compare the various parameters against a person who is infected and against a person who is not infected. The person who is infected is called as case and who is not infected is called as a control. Next kind of studies we can do is called cohort studies. We take few healthy population, divide into 2 parts, one part gets exposed, the other part does not get exposed. Then if we compare the various parameters, we get what is called as cohort study. The difference between these two are that in case of case control studies, exposure has already been occurred because I am taking the cases. In case of cohort study, the exposure occurs after selection of the study. So, cohort study is a prospective study, whereas case control is a retrospective studies. And finally, we can have experimental studies like randomized controlled trials. Okay, these are the various studies we can do for study of epidemiology. But a very important thing that we must understand, in case of population, we must also look for how the diseases are occurring. One way we can do is go and scan the whole population for the disease. That is called as active surveillance. The other is called as passive surveillance. If the person gets infected or the disease, they will go to any healthcare provider and the healthcare provider will notify to the authority concerned. That is called as passive surveillance. So, what happens in passive surveillance? It is routine reporting of cases by healthcare professionals to the public health authorities. It is easy, it is a low cost and a wide area can be covered. However, there is a high potentiality of missing cases because not all people who have been exposed will get the disease, all who are diseased will come to the healthcare provider. Alternatively, we can go for active surveillance, in which we go and look for each and every individual case in that particular population. But it is very labor intensive, it is very hectic and very difficult to do. So, active surveillance is generally reserved for dangerous diseases. For all other diseases, passive surveillance is done. Another way we can do is called as syndromic surveillance. That means, suppose a doctor, he in his outpatient department sees many types of cases. So he is not going to report each and everything. But if I tell him, let us take an example of polio. I think you already know India is polio free. But in case of polio, the surveillance was done with a syndromic approach, that is acute flaccid paralysis. So whenever a doctor encounters a child who has developed flaccid paralysis in say legs or arms suddenly, then the doctor will have to notify the public health authority. This is called as syndromic surveillance. If there is a particular syndrome, then we surveil. If you do recall, during the corona pandemic, it was always notified from the government that if you are suffering from fever, respiratory distress, coughing or sneezing, you must do such and such things. So based on the syndrome, we call it as syndromic surveillance. Okay. After we get the number of cases, we get what is called as morbidity iceberg. Now why it is called an iceberg? Because if we enlist the cases, we can see an iceberg is forming, where the tip of the iceberg are the cases that have been reported. Much larger cases are diagnosed but not reported, and even more cases are the cases where the patient has seek medical attention but has not been diagnosed. And if we delve even further, we can find huge number of cases where people have been exposed but have not even seeked any kind of medical attention. So whenever there is a disease outbreak and we get say only 10 cases have appeared, that means that is the tip of the iceberg. Many more number of people are actually infected or exposed. So whenever there is huge number of cases, we call it an outbreak, which will lead us to do something, we call it as an investigation. We call it as an outbreak investigation. So there are 14 steps of outbreak investigation, where we have to confirm that outbreak is actually happening. Then we have to confirm the patient who is infected actually the proper infection has occurred or not. We have to confirm that disease microbiologically, and we have to look for various parameters by which the disease has spread to other people. Then we have to verify the diagnosis, that how this disease is spreading, prepare a case definition, look for new cases, and this information should be provided to all healthcare so that they can treat these new cases and confirm the hypothesis and give the final report and communication. This is what an outbreak investigation is done. Just remember, all these are steps, but they are not followed serially. Because whenever an outbreak occurs, we need to implement many things at a simultaneous time. We need to confirm the case, we need to confirm the diagnosis, we need to confirm the outbreak, and also we need to start preventive measures simultaneously. So all these things happen simultaneously, it's not one after the other. Okay. After doing the outbreak investigation, now we can confirm whether the outbreak is a common source, propagated, or mixed. Understood? Investigation of the outbreak will give us case definition. Why this case definition is required? For all healthcare providers to look for the similar disease. Laboratory confirmation can be done by various methods, including serological methods, and these laboratory testings will give us these 4 parameters. These testing parameters are the sensitivity, the specificity, positive predictive value, negative predictive value. This helps us to find new cases for diagnosis. Till now we had only covered about the epidemiology of the infection that happens in the population. But there is one more significant aspect that I will touch upon very little. That is infections that happen in the hospital. Those are called as the healthcare associated infections. In those cases also we need to study about the epidemiology. Why? I think you have already heard about the HI, that is the urinary tract infections, surgical site infections, pneumonia and bloodstream infections. So why these are required? Suppose there is an outbreak of urinary tract infections in ICU, that means all the patients are being put, catheter have been put in them. That means somewhere there is a failure of the infection control procedure. That is why the outbreak is occurring. So that is also an outbreak in which we have to investigate. Again, in case of HAIs, there are different rates which are different from the previously what I have told you, and these rates can be compared with other hospitals or national benchmarks. Similarly, another problematic statement that we face in the hospital is antibiotic resistance. Now, this antibiotic resistant organism may spread from one person to the other or one ward to the other and the whole hospital itself. That also will lead to an investigation. That also comes under outbreak investigation. And the final aspect that we can do, other than all environmental approaches to prevent the outbreak happening, environmental approaches include, will depend on the pathogen, the vector. For example, if there is an outbreak of malaria, I think you have seen many government, they start advising during the rainy season that you should not let any water collect in your household, etc., to stop the propagation of mosquitoes. So if we stop the propagation of mosquito, we can prevent the outbreak of dengue, malaria, etc. Fine. The only step that we can do to prevent the infection from happening in host, that is human beings, is through immunization. Immunization against specific diseases, either active immunization or passive immunization in the cases where immunoglobulin actually works. Finally, all these investigations, all these data can be put into mathematical model. The R value is calculated, which helps us in predicting whether the epidemic will propagate or not, how long the epidemic will last, which helps us in planning and implementing various administrative and healthcare policies. There is a mathematical model. If you know that, that is fine. Okay. So to conclude, infectious diseases focuses on epidemiology focuses on population, transmission, dynamics and prevention. Understanding is very important to break the chain of transmission. Why? Because still today infectious disease is a major global killer and prevention is better than cure. This dictum still applies even today in today's advent of various advanced diagnostic and medical healthcare setup. Okay.